Welcome, everyone. Thank you for joining us tonight. My name is Haley Greenstone. I use she, her pronouns. I'm a fourth year MD MPH student applying into OBGYN, and I'm the Gender and Sexual Health Subcommittee Chair for Doctors for America. I'm really excited for our webinar today. Before we get started, I wanted to take a quick minute to invite you to officially join Doctors for America if you're not already a member. Being a DFA member today means taking the important and simple step of selecting a membership level and paying your annual membership dues to support DFA's organizational sustainability and incredible programs like this webinar. There are 4 different levels to choose from. A DFA team member will put the link to join in the chat. We will also be sharing our recording and making all materials available afterwards. A few quick ground rules for this webinar. There is no such thing as a stupid question. Please ask any questions that you come up with. We may or may not have the answers, but we will try and get you the answers if we don't have them. Speaking of questions, please use the Q&A feature. We will also address your questions during the latter half of our session. And look out for any comments in the chat. DFA staff will share things as well as some of our lovely speakers. So on to our speakers. We are joined by the 3 members of the Gender and Sexual Health Subcommittee who helped author this guide on physician advocate safety. So that is Suraj Joshi, he, him, Jackie Liu, she, they, and Andrew Norton, he, him. These 3 have done some great work on helping to address the needs of our physicians and especially those who advocate for their patients, whether it's more clinical, doing risky politicized care, or whether it's speaking out and addressing the systemic problems that we're noticing. And it's also really important that in order to do that work, that we acknowledge the risks that we are taking as physicians and trainees in these spaces and do the best that we can to protect ourselves so that we can continue this work. So without further ado, I will go ahead and share the slides. So these are our authors, as I just introduced, and the team who will be presenting tonight. So advocacy in 2025, as we know, there's a lot of increasing risk to just practicing medicine, from misinformation that's breeding mistrust, the politicization of science and health, as well as violence and attacks on healthcare institutions and providers. And speaking out and advocating more beyond the clinical space inherently is going to increase that risk. So the question we wanted to address with this guide is, how do healthcare professionals protect themselves to stay in medicine and continue advocating for health and human rights? So we broke this down into 4 domains of safety. So we have physical, which is obviously reducing physical risk, emotional and mental, so addressing moral injury, burnout, compassion fatigue, cyber safety, so managing your internet presence and responding to virtual harassment, and then institutional, so what your institution is already doing for you and working with those institutions to expand that safety and support.
Awesome. And it's my honor to introduce our physical safety, which we've broken down into know your resources, situational awareness, hospital policies, trauma-informed security, and institutional awareness. For know your resources, it's basically understanding and maintaining awareness of available resources, including personal protective equipment, emergency protocols, support services, and external agencies that are critical for responding effectively to safety threats in healthcare facilities. This encompasses knowing whom to contact for security assistance, where to locate safety equipment, and what internal protocols or external organizations can be assessed in emergencies. For situational awareness in healthcare involves being consistently alert to current environment, recognizing potential hazards, and staying attuned to changes in patients' behavior, surroundings, and other risk factors that can threaten the safety of staff, patients, or visitors. It is an ongoing mental process of assessing what is happening, predicting possible outcomes to maintain the safe conditions. For health policies, these are health hospital policies for safety, referred to the formalized set of expectations, procedures, and regulations developed by the healthcare organizations to ensure a safe environment for both patients and staff. These include protocols for hazard identification, reporting, violence prevention, emergency responses, and compliance with OSHA requirements, while also fostering a strong safety culture led by management with clear assignments and accountability. For trauma informed security, this means integrating an understanding of trauma and its effects in all security practices. This approach emphasizes physical and psychological safety, trust, transparency, and empowerment, striving to avoid re traumatization of patients or staff who may have previous trauma histories. It requires security personnel and other staff to be trained to recognize trauma responses, use de escalation strategies, and contribute to supportive, respective healthcare environments. And then for institutional awareness is the knowledge of operational environment, culture, and overall structure of the healthcare facility, including specific risks, resources, history of incidents, and typical patterns of care, involves understanding not just one immediate unit, but the broader institution to anticipate challenges, recognize vulnerabilities, and proactively engage in safety practices that align with organizational goals and regulatory standards. These concepts overall work together in order to provide a safe environment for all individuals to work in.
Awesome. Thank you, Andrew. After that, we have emotional and mental safety. So just quickly to go through. So we know that physicians, trainees, and other healthcare providers can experience all different kinds of distress and very distinct forms of distress for many reasons, like due to having our hands tied, institutional barriers to proper patient care, the legal landscape's constantly changing, misinformation, and then other sources of preventable patient suffering. So the first step to actually ensuring one's own mental health as a provider is recognizing and naming the specific form of harm on the top left. So page 3 of the safety guide covers this in detail, but the 4 key words that I think are very helpful to add to our vernacular are burnout, which we're familiar with, moral injury, compassion fatigue, and secondary traumatization. So the first term, burnout, we've heard many times, and we understand it as a sense of exhaustion when work doesn't produce the outcomes we hope for. But other forms of injury can look different. Moral injury is when the work that you're putting in may actually lead to worse outcomes, or you're feeling that a patient's autonomy has been violated in ways you can't even affect. And then secondary traumatization is the sense of trauma that you experience after witnessing suffering. And these are all very distinct forms of harm that have to be named and handled distinctively. The second step is using this language. We recommend seeking support. Find your peers and name the form of harm that you're experiencing with them. The third step is to ensure access to peer support services within the institution and to distribute stress whenever possible. So we already do this in general in terms of our clinical settings by rotating staff on and off call, who has call, who doesn't have call, who's long, who's short. But this approach should be generalized to the provision of modalities like gender affirming care, who's long for this service, who's short, just so that the total amount of stress doesn't get put onto one person and they get burnt out or traumatized and then pushed out of that care modality. The last thing is to facilitate care. We want to prepare to discuss ethical challenges and moral injury by having the language down pat. So importantly for this, it's important to schedule regular well-being check-ins and facilitate referrals for our colleagues whenever they need that support. So really having the language to express these forms of harm and the support network collectively to have dialogue about them is really important.
So cyber safety is very complex, and there's a lot of layers to what we can do to protect ourselves. But I decided to really focus in tonight on doxing, which ends up taking up a couple pages of our guide because it is a complex issue. So if you're interested in looking at some of the other kind of more general guidelines or some of the other experiences that people are concerned about or needing to navigate, that will be on page 4 of the guide. But regarding doxing, I know that that is particularly of concern for the providers of things like gender affirming care, abortion care. And first of all, to address it, we have to define it. So doxing is the publishing of identifiable information of a person with intent to cause harassment both virtually and or in person. So this can be when someone posts your email without your permission, trying to get people to flood it with hate mail, but it can also be someone posting your address. So ideally, we prevent this from ever happening. So to do that, you need to know your online presence. If you've never Googled yourself, you need to Google yourself and see, is your information shared with your consent? Is it shared to places that you've approved in ways that feel safe to you? If your CV is somewhere, does it have your phone number and address on it? And do you want to take that down or replace it? Then opting out of data brokers. This is a time-consuming process that I have not engaged in myself yet. But there are a lot of data brokers that have our information, and there are some major ones listed in the guide that you can opt out of. You can also pay for services that will do that for you, but you can also do it manually for free. Cleaning up social media, so knowing what accounts you have, what availability to the public they are, making things private that you want to keep private, and increasing those kind of security measures. Restricting location tracking. So obviously that would be for like any apps on your phone that don't require it. Obviously Maps needs it, but does Instagram, does Facebook? So really thinking about what has your information about your current location and how specific it is. Is it the city, or does it actually get down to that like street level information? And then something I didn't know about until we were making this guide was photo metadata. So when you post a photo to social media, if you haven't kind of looked at the like identifying information for that photo before, they come with metadata, which is the location, the exact time it was taken. There's a lot of data on there, and you can remove that and then still post those photos. And that process is described a little bit more in the guide as well. Avoiding third-party sign-ins. So when you sign up for a new service and it says log in with Apple or Facebook or Google, when you use those, you're giving them permission to have that information and to access that account as well. So trying to avoid those and just using password managers instead. Keeping separate emails for separate purposes. A lot of us already do this, but having a spam email for signing up for those like rewards points, and then having a personal email for communications with friends and family, and having a professional email or multiple, depending on how many roles you hold, for just your own organization, but also to help reduce the risk of your private information being accessible. And then considering VPNs so that your location when you're using your data or your devices is not as easy to pin down. However, even if you did all of this, there are still ways for people to dox you. And so to mitigate this, the first thing we recommend is to contact your hospital or your institution and their safety team for help reporting this. Document everything, whether it's just finding out someone posted your information or whether you're getting hate mail or threats or whatever it is. Make sure it is like documented in writing, photos, videos, whatever you have. And then request takedowns if at all possible. Not everything can be taken down very easily, of course, but if it's something on your institution's site that could then further that doxing experience, then ask them to pull your information, things like that. A lot of states also have doxing laws now, so knowing those is really important, and then seeking legal support. Because if you're in a state that have like anti-doxing laws, you can then press charges and really protect yourself that way. We worked a little bit with the Digital Defense Fund on this, and there are a lot of great resources shared in the guide for kind of further cyber safety, because this is a very complex topic.
Thanks, Haley. So for context for this section on institutional practices and procedures, I think we were considering this section in the context of, in today's healthcare landscape, physicians are practicing more and more often in a consortium or kind of a bureaucracy, whether that be at like an academic hospital or a community hospital or even like a physician group. And how can you work as a collective or as a larger institution to fight for your patients getting the proper healthcare that they deserve and also protecting yourself at the same time? That being said, it was actually quite difficult to find information on how to concretely achieve those things. So I will give that caveat as I'm presenting this portion. One thing we were thinking about first was kind of knowing your state laws, kind of how Haley was talking about knowing like your state doxing laws or something to that effect. And we were thinking specifically about SHIELD laws, which are defined as legal protections for patients, healthcare providers, and people assisting in the provision of certain healthcare in states where that care is legal, from the reach of states with civil, criminal, and professional consequences related to that care. That's typically thought of in regards to abortion care, and UCLA, which we've linked in the guide, has a great resource on knowing what your state SHIELD laws specifically are, because they can protect from certain civil, criminal, or professional litigation. So I would look for that on page 8 of the guide. And then specifically when you're advocating on behalf of healthcare professionals to your institution on how to best protect yourselves when you're providing this sort of more legally contentious care. We've also put in a list provided by the American College of Obstetricians and Gynecologists on questions you should be asking of your institution on how to protect you and other healthcare providers. But moving on to this slide and how to more concretely identify ways your institution can protect you. Looking at the left, specifically what they can do is support providers in providing care, advocating specifically on social media, or protecting physicians' right to advocate and speak out on behalf of their patients and the care that they provide, and also giving the academic freedom to do the research to further substantiate the kind of care that they provide. This is more related to physical safety, going back to kind of the first section, but also prepping security teams. I mean, Boston Children's obviously is known for kind of that bomb threat back in 2022 when it came to gender affirming care, but obviously making sure that your security teams are prepped on how to protect these specific places and these specific teams is really important, as well as media. Showing as an institution that you speak up on behalf and support this type of care is incredibly important for showing solidarity, but also showing that you stand up for your physicians or in healthcare providers and providing this sort of care. It goes in line with utilizing platforms, providing protections for clinicians, and I think that goes hand in hand with engaging legal counsel to instruct physicians and give more concrete ways of what can you do and what can't you do in your specific state and at your specific institution. I think the biggest thing is continuing evidence-based care. I mean, that's what we do as healthcare professionals, what we should continue to do, despite attacks on this type of care that we provide. And then thinking more about how you get to those protections, we were thinking a little bit about the Committee of Interns and Residents, which is a big unionizing organization for residents and trainees. And through their examples of coalition building and collectivism, I think they've done really great strides in protecting trainees and fighting for really great policy wins. So I would look to them and their website, which we've also linked. Similar to that, engaging stakeholders and those who you know will be willing to collaborate with you as a way to kind of get your foot in the door to seek those opportunities. And again, utilizing social media as a way of creating a bigger voice to push these institutions to do something, I think is really critical.
And before we finish up, I wanted to make a note on legal safety, both civil and criminal. We recognize that legal safety is a very, very important part of the puzzle here, but the legal landscape is incredibly complex and uncertain, and we can't give generalized guidance around all legal issues that are being faced. So we opted to not include that in the safety guide. However, DFA has guides on specific legal challenges on a state-by-state level that have been updated periodically. For example, some SHIELD law, know your rights guides regarding gender affirming care and abortion in jurisdictions with SHIELD laws. And we are continually collaborating with different law schools across the country and open to creating similar guides as desired. So if there are any particular regions, states, any connections you have, any specific laws that are of particular concern right now, obviously gender affirming care and abortion are some hot button legal topics right now, but there are plenty of other laws that are affecting providers in very complex ways. And so if that is something that you are interested in, please let us know. We're happy to help kind of further that work and make sure this information on some of these legal barriers are more accessible. So thank you all for joining. Please ask questions, provide any comments through the Q&A feature. I saw that we have a couple comments in the Q&A space. And then I will also make these slides available at the end. It has a link to the guide and any other DFA resources, including some of those SHIELD law, know your rights guides. And please consider joining DFA if you're not already involved, and particularly our health justice and equity impact area. We are the group that focuses on sexual and gender health here tonight, but we also have 2 other great subcommittees in HJE that would love to have you. So I will stop sharing now. I see we have a question that is very relevant to me as well. As someone applying to residency programs right now, what are some questions I can ask to gauge if the institution has those protections in an appropriate way? This is something I've been thinking about a lot too, and I'm not sure if anyone else has any good answers for this. But I think one thing that's important to ask, or to at least know, a lot of programs are advertising it now, but know if they're unionized, because that also tells you the power that the residents and fellows have in being able to get their institution to back them in that capacity. And then I think asking, you may not get the answer on the overall institution, but at least how the program supports. I think asking like, for me, since I'm applying into OB-GYN, I'm asking them like, what kind of support do they have for residents who engage in advocacy? What kind of, like, do they support LGBTQ plus care? Like asking some of those questions. Do they offer that to their patients? How have they supported their attendings and residents as they face certain challenges in this space? So that way you're really trying to reframe everything in a positive light, rather than saying like, kind of what failings does your program have? I think it really kind of highlighting, like giving them an opportunity to say the things they're doing well, and then asking residents how supported they feel, both on a personal level as well as like when they're trying to address unmet needs in the community. Are they getting support for that? When they're in red states, are they getting training for certain kinds of care that are more politicized there by getting support by the institution, sending them to other states, or other institutions even within the state that offer that care? So those kinds of questions I think can be really helpful. And that's particularly relevant with OB-GYN, and it's sometimes easier because it's so politicized, but I think it's something that you can very easily adapt to a lot of those other fields. I know a lot of them are politicized right now, from infectious disease to pediatrics to like pretty much everything. So I think it's a very appropriate question to be asking in this day and age too. And programs responses, if you're asking it tactfully, will also tell you a lot about the kind of program that they are, even if they don't have clear answers, the way they communicate. And if they act kind of receptive to that and like they're trying to figure it out, or if they act kind of put out by that question, I feel like would tell you a lot as well. If anyone else has any other thoughts, please feel free to share them or drop them in the Q&A.
I can go. I know I just want to preface, I have also not applied for residency or done these interviews, but I've sat down with a lot of individuals that kind of listen to how you ask these questions because I think they're a great opportunity in order to go about asking anything in general from like anybody who has a position of power over you. And I was told to kind of ask it as like a situation-based question. So it could be something as simple as like, how does your program or hospital system help protect students during, and then insert a situation, just so that you can kind of see how the individual is going to respond to that question and if what information they're going to be providing. Because that'll also give some context of like, if a situation were to occur, is this person prepared to like help support you as a student when you're during your residency program? And are they also aware of like the resources and everything? Because it kind of allows you to gauge what resources are also there and like how they would address that situation if it were to occur.
Also, if anyone who's listening in has faced any challenges or any successes with navigating, particularly like institutional safety and support, I think that could be really valuable to share with people. Always happy to have people who have gone through this experience in different capacities share their thoughts and feelings about it. We are all coming from this from the perspective of trainees, and so I know that there's different vulnerabilities at different points in the process.
Hi, my name is Sarah Maman. I was an emergency medicine physician or resident. I'm sorry. I didn't finish residency. I was diagnosed in my intern year with bipolar disorder, and it wasn't a known, like I had depression for a long time, but white knuckled it through medical school, was put on an SSRI, and the SSRI unleashed the mania in my intern year. And my program was really supportive. They really tried their best, but I was in a state that didn't have a lot of mental health resources. So instead of getting the psych care I needed, I was sent down the rehabilitation. Like I had a destructive relationship with alcohol, but I was sent to rehab. And I'm not mad about it. I think I needed it, but it wasn't the right type of care. And if I had been in a different state, I think I would have gotten the care I needed, which I did later on, but after a lot of strife. And that just worsened my depression, my suicidality. So it was a really traumatizing process. And I feel like I came out of it thinking that if I were to do it again, I wouldn't self-report because I did it all the right way. I went through the residency program and went through, I just, yeah, I wasn't ready to leave medicine. And I feel like I was forced because of my mental health diagnoses. And if I had been in a different stage, I think I could have managed better. So it is what it is. I'm not telling people not to reach out for help because if you're in a dark place, you should. And there are people around you who care, and there are a lot of people who can help. But for me, I use my social media and the fact that I keep myself public so I can share about mental health, and that's my form of advocacy. So I thought it was really useful, the stuff that you guys were saying about doxing. But now that I've left medicine, I don't know, it's different. But I'm signing up for DFA. Hope to see y'all around.
Thank you so much for sharing your story. I know that must have been an incredibly painful experience. And I think that knowing the risks of keeping yourself, like your social media public and things like that, there are risks to it. And also I think the most important thing is knowing the risks that you're signing up for. There's risks to being a physician. There's risks to being a physician who provides certain kinds of care. So there are some people who want or need to pull themselves completely from the public eye with like cyber safety needs. But I think everyone can make that decision on their own. And I think that's so important that you are keeping your social media public so that people can understand and find support that they need. And we're very, very glad to have you joining DFA. We really love that we will get more, another really strong advocate, and hope to see you around at HJE.
Hi there, hey everyone. I really appreciate this. I'm an old timer. I finished residency back in 2004, but actually I find myself like almost like a second act in my career. I'm in nuclear medicine, but actually my focus of my career now is advocating for gender affirming care, especially for trans youth. And so, been very fortunate. Actually, I was the very first openly trans physician in the history of Kaiser Southern California. That was 11 years ago, and so it's been an incredible journey seeing where it's gone from nothing to something feels like significant to a point where it almost feels like a liability now. But I want to say something, and especially appreciate the last, I think Sarah right before this sharing about. I appreciate your vulnerability about your story, about mental health journey. One thing I do want to say is this, and I hope this is a safe space to mention, is that be careful for all of us when, especially if we feel like we're in distress, be careful about well-being committees in hospitals. The well-being committee isn't actually for the well-being of the physician so much. It's legal protection for the hospital and the protection. So a lot of times they're going to do more to try to, they can be they're more important about keeping their reducing their liability than actually advocating for the person who's in distress. I just want you to be really careful about what it is. It's a little bit of, this has my experience in multiple institutions, that but a well-being committee, it's a little bit of it is a misnomer. It's not about the well-being. It's about making sure that is this person safe to practice in here, and they're going to be on the defensive side. And so a lot of times they railroad people into things that may not in their best interest, but also to reduce the liability of the program institution. So I really just to be careful about that. There are safe people. There absolutely are safe people. I would try to be a little more confidential about it. I think really, but just like those well-being committees are some things that are almost like a not a regulatory function, but it is something that is sort of mandated. And so, but not necessarily there to say, hey, what can we do for, like so we have a resident, a student, or an attending in distress. We actually do have confidential programs where about like peer-to-peer. And that really is really helpful. And we do that even within Kaiser. So their encouragement is anytime that we know someone's in trouble, we actually try to actively reach out. But a lot of it is just about not even talking about mental health, but anytime someone's in a position where they're vulnerable, it could be because of them threatened their safety. Just myself, because I advocate with my gender affirming care. Sometimes quite publicly, I've been doxxed. And so I'm looking through these slides as, oh, this is super helpful stuff. I'm glad people get ahead of it. So I really appreciate what you're all doing here. But I just wanted to just share a little bit of that. And but I really do absolutely appreciate this talk, all that you're doing. I did download the resources. I'm going to share with my own medical students and my own institution as well. So thank you so much for it. And I hope that, that we gonna all keep fighting the good fight. We're not backing down, not on my watch. They're not going to strip away care from any vulnerable population not on my watch. So thank you all. And I appreciate the fact that y'all in the place in your career that y'all poised to do amazing things. So I know, hey, the kids are all right. I think the future is in good hands. So thank you all.
Thank you so much, Allison. Very, very important to recognize that there are a lot of structures that sometimes look to be one thing and they are not that, and especially recognizing, and I think it's something we've probably all experienced in one way or another, that institutions protect the institution first. And so we're keeping that in mind as we're seeking out those resources and those safe people, and those safe programs, knowing like, are they confidential? What kind of supports will they give me? I think that's so important. And thank you for doing the work that you do advocating for gender affirming care. I know that that is a very important fight to be in right now and something that's near and dear to all of our hearts. So thank you so much for sharing. And I'm glad that our resources are helpful.
Yeah, thank you, Allison, for paving the way for folks like us to continue fighting the good fight. I feel like it's not often acknowledged that there are physicians before our time who had to do this so that we could continue and carry on the torch. But I think you bring up a really good point of the fact that like collective advocacy oftentimes cannot be done like in conjunction with like institution sanctioned resources, that oftentimes you need to find solidarity amongst the people that you know are safe, and that takes time to figure out, and you'll make mistakes along the way, and that's okay. That's why I think like things like unions are like so useful, because they are people who are in the same position as you, in the same level of training, and you can collectively come together. Like there's so much power in people. And I appreciate you bringing up that point. There's like the last page of the guide has a quote from Audre Lorde, which I put in because as a women's studies major, I feel like I have to reference her, but like like it's one of my favorite quotes of her, which talks about how you can't deconstruct the master's house with the master's tools. And I think what you brought up about the well-being committees really nods to that, which is the idea that like you can't utilize oftentimes what's given by the institution to accomplish what you want as a person. And sometimes that's really hard to do in these advocacy spaces when you're trying to fight for your marginalized patients. So I appreciate you acknowledging that dissonance as well. It's something that I feel like we all feel, and it's really hard to navigate at this point.
I want to thank everyone who came and attended tonight, and especially those who asked questions, who shared their stories. Thank you so much for your vulnerability, and for your guidance as we are all trying to navigate the space. Whether you've been advocating for a long time or just got involved, it's a very complex and intimidating landscape that we're facing right now. And we need all the support we can get from each other. I also really want to thank this team, Jackie, Andrew, and Suraj. You all have done such an amazing job working on this guide, and I am so looking forward to seeing what we do next in the Gender and Sexual Health Subcommittee. And to that end, if anyone is interested in getting involved or has may not have the bandwidth to get involved, but has ideas for things that we could do that would be useful to you, please reach out. We are very happy to collaborate. Couple of quick reminders before you all leave tonight. Education is important, but so is action. So after tonight's session, we would really love that you could share what you learned with any friends and colleagues, especially those who are most vulnerable to threats to their safety. So our marginalized populations in medicine, those who care for vulnerable populations, people who work with immigrants, LGBTQ plus patients, and really anyone at this point may be in a vulnerable place. So please share this widely. See what you can do to understand and maybe improve your institution's response to physician advocacy and safety, if there are anything that you can do. Obviously keeping in mind that we are in a hierarchical field, so you don't have to go out of your way, but see what's out there, and consider getting involved with DFA. Invite others to join. Please keep an eye out for additional opportunities to provide input on future policy issues. And again, let us know if there's anything that you would like DFA's health, justice, and equity impact area to address. And if you enjoyed this session, please consider supporting DFA's work and impact with a financial gift or joining as a member. Thank you all for being here and all that you do on behalf of patients and on behalf of our providers as well, and keeping us safe and supported. We hope you will become a DFA member, and please take a look at the benefits of membership on DFA's website. The number one reason doctors, medical students, and health advocates join DFA is to be with like-minded people that share the same values and priorities. Please remember to follow us on our social media, stay up to date with DFA programs, events, and ways to get engaged. Thank you all so much for attending, and have a great rest of your evening.